let's look at ectopic pregnancy. So basically, it's defined as implantation of conceptus outside the normal uterine cavity. Types, as you can see from the diagram, could be outside the uterus, the fallopian tube, the ovary, um, abdominal cavity, and also abnormal positions within the uterus, like the cornea, the cervix, and also it could be heterotopic, as combined tubal and uterine, but that's very uncommon. Okay. So the risk factors of ectopic pregnancy, PID, that's pelvic inflammatory disease, pelvic surgeries, multiple sexual partners, as in promiscuity, also congenital defects of the fallopian tube, also previous ectopic pregnancies, maternal age in young men. Normally, increased maternal age is questionable. The presence of intrauterine contraceptive devices too could cause ectopic pregnancy, but it's not a direct cause, but due to the relative efficiency of the intrauterine contraceptive device, it just prevents intrauterine gestation. So the clinical features, always remember that any woman of reproductive age presenting with pelvic pain or bleeding should have ectopic pregnancy ruled out. That's that gives just a high index of suspicion to no pathognomonic pain or clinical findings which are diagnostic on ultrasound, as pseudosacral diagnostic on ultrasound. So these two scenarios, you have to look at them very well. If there's amenorrhea, no abdominal pains, and also collapse, definitely the patient is in shock due to probably a ruptured ectopic pregnancy. So that's the easy diagnosis, but it can be extremely difficult if the pregnancy test comes out negative. So normally the history, there's amenorrhea with low abdominal pain, with or without abnormal bleeding, as in blue and prone jelly. Okay, so the examination in this scenario, one that I give, the patient is unstable or shocked. There is pallor, shock, abdominal distension. There may be shoulder tip pain, referred pain from the irritation of the diaphragm. So in such a cases, don't say this severe anemia with ascites. Could just be a ruptured ectopic. In the scenario 2, where the patient is relatively stable, requires other investigations like coldocentesis, laparoscopy, and abdominal tap as paracentesis is normally not done. So the treatment, you do investigations, grouping and cross matching, surgical laparotomy or laparoscopy, salpingectomy, ruptured ectopic. So you do an autotransfusion, linear salpingostomy in an unruptured ectopic. For medical, as in unruptured ectopic, you can just give methotrexate and then potassium chloride injection into the fetal heart, prostaglandin injection into the sac, or hypertonic glucose 50% injected into the sac. Okay, so the definition